Hi, this is Dr. Dumestri. So I'm going to talk a little bit about implant removal, and specifically implant removal when you have saline implants in place. So say you've had your saline implants placed however many years ago and you are no longer interested in implants. And that could be for a whole variety of reasons, but you're presenting to me wanting them out. So now the question is, do we just do an implant removal? Or do we want to do an extra little something at the same time to reshape the breast? So that would be, say, like a lift to make the nip a little bit more perky, tuck in any looser skin, could do some fat grafting, some fat transfer to the area to further thicken it up, give a little bit of better contour, or potentially use mesh depending on how much of your own tissue you have. Now, sometimes it's obvious. So if the patient has the implants for a long time, they've got kind of a big hanging breast and quite a bit of their own breast tissue, then I can pretty reliably predict that for the most optimal aesthetics, they're going to be wanting a lift for that. Now, say as smaller breasted women, not a ton of extra skin, it's a little bit hard to predict sometimes where that breast gland is going to sit once the implant has come out and once that skin has naturally had some time to shrink in by itself. So in these settings, it can be really nice to first deflate the saline implant in clinic. So just a tiny little needle poke and basically sucks out all of the fill from your silicone shell, so sucks out all of the saline. Then initially the breast looks a little bit weird, so immediately after deflation you can kind of see all the ridges of the implant, and then even as soon as a couple weeks later things really kind of fluff out and you get a fairly accurate picture of what your breast is going to look like. That can then help guide you for implant removal versus the other surgeries I was talking about. If you want to see an example of what this looks like, you can check out my most recent post on my Instagram, Dumestri_plastic surgery, and you can really see how this helped to guide this patient to doing implant removal alone, not planning or booking for any type of lift, because ultimately she really didn't need it. Have a great day.